Today we have Yvette from My Hong Kong. She's a founding board member, also our Luncheon summer. She'll be moderating this fireside chat. And for speakers, we have Dr. Po-Mui Lam from the Women's Clinic Group, and we have Dr. Alice Wong, also from the Women's Clinic Group. And last but not least, we have Ms. Anita Chan, General Manager from Obstetrics Healthcare. We'll be talking about various issues of women's health, including menopause, mental health, and fertility preservation. So let us get started. Thank you, Yvette.
Thank you, Calvin. Thank you for having everyone here. It's this is such a relevant topic in this room, and so thank you for the brief introduction. Maybe I'll have a brief introduction of myself again. So hello, I'm Yvette, and welcome to a fireside chat on women's health. So I am your moderator for today, and as an Olympian, and as you may know, a founding board member of My Hong Kong, I'm very interested in well-being, and today it's an honor to be facilitating this important conversation featuring some exceptional experts in the fields of fertility preservation, menopause, and overall women's well-being. So, let's see. Now, maybe I'll briefly introduce all of our exceptional guest speakers now. So, Dr. Po-Mui Lam, hello, a specialist in obstetrics and gynecology from the Women's Clinic Group Limited. So Dr. Lam has a doctorate in medicine from the Chinese University of Hong Kong. So Dr. Lam also spent the past 25 years honing her expertise in reproductive health. So during this time, she has dedicated herself to providing exceptional clinical care for patients struggling with infertility and subfertility. So in addition to her extensive hands-on experiences working directly with these patients, Dr. Lam has actively enhancing her research capabilities. So she has conducted in-depth studies on a range of reproductive health topics and published over 40 papers. 40, wow, in respected international journals. So maybe we can give a round of applause for Dr. Lam. So our next guest speaker is Dr. Alice Wong. So Dr. Alice Wong is also a specialist in obstetrics and gynaecology, also from the Women's Clinic Group. So Dr. Wong graduated from the University of Hong Kong in the 1990s and received training in ONG and endocrinology at the Guanghua Hospital and Queen Mary Hospital prior to further training in reproductive medicine in Cardiff, Wales. So she started her service in assisted reproduction at Dr. Stephen Chow Chun K Assisted Reproduction Center of Guanghua Hospital, Hong Kong, where she was responsible person and accredited specialist until 2014. Now, she is a full-time fertility specialist in the Women's Clinic Group and an honorary clinical associate professor of the Department of ONG. Wow. And so she is now also an educator at the University of Hong Kong. Yes. She specializes in reproductive medicine and with a focus on endometriosis, poor ovarian reserve, and fertility preservation. So maybe another round of applause. Thank you. So our third speaker, Ms. Anita Chan. So Ms. Anita Chan is a general manager, Fireside Healthcare Hong Kong Limited. Anita Chan is a very successful licensed pharmacist, and with over 2 decades of experience in healthcare, she has been instrumental in advancing women's mental health initiatives. Under her leadership, Fireside Healthcare has launched impactful programs to address mental health issues and reduce stigma. Very important work. Anita is also an advisory board member and adjunct tutor at the School of Pharmacy at the Chinese University of Hong Kong, and an adjunct tutor at the School of Pharmacy at the University of Hong Kong. She is deeply committed to people development and empowerment. Having had various teaching positions at tertiary institutes in Hong Kong, and she is recognized as a thought leader. So Anita combines her professional expertise with a passion for mental health advocacy. She holds a master's degree in health administration and is an active member of several professional organizations dedicated to healthcare improvement. So maybe a round of applause for Anita and for everyone here. Several guests, and then I'm sure there's a lot of questions from the audience already, but let me ask first. And then after taking turns with our exceptional speakers, we'll have a Q&A round. So have your questions ready. So how about we will start with, sorry, let me flip my cheat sheet. So how about let me start with Dr. Lam?
Yeah, sure.
So Dr. Lam, fertility preservation has been in a way a trendy topic. I think for especially for relatively young career-driven women, which including myself.
Yeah.
And a lot of people will be interested to understand what are the basics and how should we approach this topic. So may I maybe I can start with this. What factors should women consider when deciding if and when to pursue fertility preservation?
A good question to start with. They should consider 3 factors, I would say. The age, the ovarian reserve, as well as how many kids they plan to have. All women have a biological clock. We were born with a fixed number of eggs or oocytes, around 1 million, and we can't further produce new eggs after birth. Unlike men, they can produce new sperm every few months. So the number as well as the quality of eggs will decline with age. So the older we are, the chance of pregnancy reduce, and more importantly, the risk of miscarriage or fetal chromosome abnormality will increase. So it's always a good idea to plan ahead for the fertility preservation. Having said that, age is the most important determining factor. The ovarian reserve may vary among women with same age group. So that's why we need to check our ovarian reserve as well.
I see, thank you. So may I ask, how can women assess their ovarian reserve? How do you know?
There are 2 simple methods. One is by the blood test and the other is by an ultrasound scan. For the blood test, for the hormone level, what we call the AMH, anti-mammalian hormone, can give us some idea. It can be taken on any day, regardless of your menstrual period. The higher the level, the more eggs you have. Another method is ultrasound scan, preferably transvaginally, but it should be performed during menstrual period, day 2 or day 3. So it's time limited. And we can count the antral follicle, also the baby follicle in each ovary. Theoretically, 1 follicle carry 1 egg. And I must emphasize that both tests can only assess the quantity, but not the quality of eggs. That's an important message. Take an example. For example, with same level of AMH level and antral follicle count, a 30-year-old woman is more likely to carry better eggs than a 40-year-old woman. These 2 tests still have their own value or role, because let's say 2 women of the same age, 30 years old, one have good AMH level, one have low AMH level, then that is the warning sign. She may have compromised ovarian reserve. She have an urgent need to seek expert opinion and consider fertility preservation.
I see. Wow. And so at what age would you suggest women to start assessing their ovarian reserve?
I would say probably 30. I would recommend women to check their AMH level every year since the age of 30, and maybe even earlier if they have some risk factor for ovarian compromise. For example, if she has history of ovarian cysts, like chocolate cysts, which is quite common indeed, or previous ovarian operation or surgery, or she have family history of early menopause for their mother or auntie, then they should have early check. In case they really found a low AH level or they're already beyond 34, again, please please plan ahead. At least seek some opinion before you make such an important decision.
Okay. Wow. Okay. Can I make an appointment with you?
Yes, we can talk.
Okay.
Yeah.
All right. Good to know.
Yeah.
Can you also explain, what are the different methods of fertility preservation available, and how successful they are?
Yes. While for single woman, unmarried woman, they can freeze their eggs. While for married couple, they can freeze their embryo to preserve their fertility potential for future use. Fertility preservation, especially the egg freezing, is increasingly popular, and as I mentioned, a very hot topic today because of the breakthrough in the technology, the freezing technology in 2012. In the past, it is a slow freezing method with only low survival rate. That means around only 4 to 5 out of 10 frozen eggs can survive after defreezing. While with the new method, what we call vitrification, which indeed is a rapid freezing method, have very high successful survival rate, up to 90%. So that's very promising. And more importantly, the performance of these frozen and raw eggs is similar to the fresh one in terms of the fertilization, the pregnancy rate, and even the well-being of the newborn. So that's also very reassuring.
I see. Wow. I think we have some more time, so how about one more question for now? Because this is an interesting topic.
Yes.
So can you tell us more about, I think you mentioned it a little bit. Can you tell us a bit more about the detailed logistics of a treatment cycle?
Yes. Well, the treatment cycle takes around 2 weeks period, but it needs to be starting since the menstrual cycle, day 2 or day 3. It involves a daily hormone injection to stimulate the follicular growth. Just like the diabetic patient having the insulin injection, it's a self-injection over the tummy with a very fine needle. So every day, but lasts for around 8 to 10 days. During that period, she needs to come 3 to 4 times to have ultrasound scan to monitor the growth of the follicle and titrate the drug accordingly. When the follicles are big enough, we can collect the eggs out under the ultrasound guidance with a very long but fine needle through the vagina. It is a minor procedure, takes around 20 to 30 minutes. The lady will be put into deep sleep, that means she don't aware of anything, she won't feel anything. It is a minor procedure, generally safe. Of course, she needs to take sick leave on that day, but can get back to work the next day. So I think still manageable. After collection, the egg will be frozen in a hibernate condition in the liquid nitrogen. While for married couple, the husband needs to provide a semen sample on that day. The egg will fertilize with the sperm, and those potential viable embryo again will be frozen. And as a whole, the overall successful rate or pregnancy rate is related to the age at which the eggs were collected. It's not related or not much related to the age the woman carried the pregnancy. Take an example. Let's say a 32-year-old woman have frozen her egg at 32 years old, and then 6 years later, she get married and she defeats the eggs and fertilize with the sperm and get the embryo transfer back at the age of 38. The pregnancy rate is around 40% or so, similar to those 32 years old lady, not 30 or less, similar to those older ladies. So that's why we can seem divide the fertility or family planning project into 2 parts. The first part is to freeze the young, good quality eggs, and the second part is to carry the pregnancy when we are all ready. We get married, we psychologically, financially, physically ready to be mother.
I see. Thank you. That is very insightful. And I think with modern technology, it really empowers women to be pursuing
Exactly.
passions.
Yeah.
Can I ask a question now? When is too late to please ask?
You want more?
I keep my
We
options.
can talk in private.
Okay, thank you so much. And how about we talk about another topic with Dr. Wong here, Dr. Alice Wong. And I'm sure this is a topic that is very relevant, just menopause. And Dr. Wong, a lot of us are experiencing menopause, and what is it? And also, why should we be concerned?
So menopause by definition is 1 year without period due to cessation of ovarian function. Or make it simple, your ovaries bankrupt. No more. Okay? No more production of this. So to many women, it's just a cessation of the reproductive power. But of course, behind there's much more to be looking into. Now, so in ancient times, there is no menopause. Why? Life is so difficult. The woman probably already dead due to childbirth, infection, famine, and war. Okay, but now our society is improved with a better living environment. We live longer. That's the good news, right? But when we live longer, then we see more problems. Okay, so a few decades ago, probably is I start to see wrinkles. I start to defibrillate. I start to put on weight. I start unable to sleep. Hot flush, irritable. I want to stop everything next to me. Okay, and so, but overall, this is self-limiting because with time, in a few years' time, those symptoms will subside. You get used to it, and old days we have little knowledge about menopause because it's a new topic, and the medications we can use and the information is so conflicting. They worry about cancer a few decades ago more than menopause because cancer can kill. Hot flush won't kill you, probably kill the one next to you. Okay, so, and even health providers, we are reluctant to talk on hormones because we worry that after giving you this sort of therapy, give you breast cancer, then cause a lot of problems. Okay, so keep on giving, not giving, giving, and not giving. Okay, but this was 1 or 2 decades ago. Now in 2024, we are facing probably another problem. We live too long. Women in Hong Kong easily live up to 89.
Wow.
Probably 90. And in another 10 years' time, I worry we will be seeing 100 years old easily. You go to the hospital, you can see them. So we will be seeing problems, long-term problems from menopause, which does not exist previously. Namely, bone loss, osteoporosis, heart problem, dementia. So yes, women live a very long life, but in poor quality. Why? Osteoporosis, she sustained a fracture, then become bed bound, wheelchair bound. She has a lot of heart problems, require repeated cardiac surgery, worse, dementia. She forgets her loved ones. She cannot take care of herself. This is not just a problem on the woman, it's to her family, to her children, and probably now to the grandchildren also. And of course, it will be an important issue to our society. You can see our government is paying more and more budget to manage our aging population. So, we need to have the knowledge to educate our population, our women, so that we prepare for oneself. What will be coming in the next 40 years after the menopause? I don't just want longevity. I need a high quality of life.
Yep. Very well put. And thank you for such a comprehensive insight on menopause. And it is true that we need to really look at it. So on that topic, what are the most effective treatments for managing common menopause symptoms?
I would say there's no single magic treatment. Okay? Every woman is different, all us. We have our own character. We have our own needs. We are facing different problems, and we have different priority in our concern. So all treatments for menopause should be individualized, tailored to one's own need. So, but unfortunately, some symptoms, there will be not much choice. Maybe the hot flushes, irritable mood. Okay, those, because it's really related to estrogen depletion. So most likely, it is well managed by estrogen and hormonal replacement therapy. Okay, and also hormonal replacement therapy usually will be very helpful to prevent and even to treat osteoporosis. And also, some study shows that it probably can help the heart, reduce the incidence of ischemic heart disease, and maybe also helpful in dementia. But of course, not all women, they will be suitable to take hormones, or they don't want to take hormones. And of course, some other alternative will always be true and always be helpful. Healthy lifestyle, healthy diet, good exercise, relax. That's always true, 100%.
Thank you. And I know you mentioned a little bit about sleep during menopause.
Yes.
And it is a big problem because a lot of people struggle with sleep problems.
Yes.
And so how does menopause affect sleep? And what can women do to improve their sleep quality?
Now, so sleep actually is very complex. I think even young people, they have problems sleeping. Okay, but with menopause, of course, the problem will be further exaggerated. Due to estrogen depletion, usually we will find it difficult to fall asleep. Even falling asleep, not the sound sleep, easy awakening. And there will be also further aggregated by other menopausal problems. Okay, the woman may have a sudden in the middle of, finally I fall into sleep, but boom, hot flush. Wake up. I need to breathe. And then I can't go back to sleep. Or the bladder becomes very sensitive. You need to go to the loo in the middle of the night and then wake up and then unable to go back to sleep again. Okay. So if this is really related to estrogen, then probably hormonal replacement therapy will be useful. But life is not that easy. Okay? By the time menopause, yes, estrogen depletion, but we are also depleted in many other areas. The woman may have a career problem, okay, planning for retirement. No, we can't retire now at 50. No, we need to work. But your boss may not think the same way. May experience some relationship problems with the partner. Okay? The kids, they're grown up, they have their own family, they have their own career, they're leaving home, emptiness. Okay? So these will also be problems. So if we just think it's so simple, estrogen depletion and give you hormones. No, every night she is thinking, is my husband still loving me? Is my kid still thinking about me? She won't fall asleep. Okay, so if she has other social problems, she needs to explore. Okay, needs to settle all those, talk to the one next to her. Okay, although, of course, problems may not be solved. But the problem is, women need ventilation. Let her talk. Let her talk. Okay, a chance to talk. And then find some other methods to support. Okay.
So I hope all the men are taking notes now.
Yes.
Just take it notes.
It's really good. You will have a kiss tonight.
I'm listening carefully, all down.
So yes, thank you for shedding light on that. That menopause is way more than a physical symptom. It's holistic, and then we need to tackle it from all angles. So it also seems like that during menopause, women can experience different mood swings. And how can we address mood swings, anxiety, and depression during this relatively chaotic time?
So, of course, most important is change. So it's change, but most likely it's due to estrogen depletion. Tell yourself, I'm not going crazy, okay? And realize that menopause is not a disease. It's just a change in your life. Okay, maybe something good. You can do something you've never done before. Okay, so, but occasionally you might need some assistance, like hormones. You need discussion, you need understanding from your partner and your family. And but occasionally, there might be really some psychiatric problem. Okay, so occasionally you might still need to seek psychiatrist assistance and treatment. I would like to compare menopause with the theory of half a cup of water. Okay? Whether you think somebody drink your half of cup of water, or somebody left half of cup of water for you to drink. So menopause is, do you think you have lost half of your life? Or you think you still have another half of your life to explore? If you're the latter, congratulations. Okay? Try to explore your stuff. Previously, you might complain, I have no time, I'm working so diligently, I have no time to do something I love. No excuse, you have plenty of time now. Do something. Jump out of your comfort zone.
That's a great way to be tackling and on that, I wonder if there's also some actionable advices on, say, dietary and exercise that we can take home tonight and start doing tomorrow.
So dietary, always correct, no matter man or woman, young or old. Okay. Healthy diet, no smoking, no alcohol, no fat. Low fat, low salt, low sugar. I'm always 100% correct. Never be wrong. Okay, but you see something more on menopause, then I don't want to take hormones, any possible supplements. So phytoestrogen is something you can consider. So phytoestrogen is actually a plant compound derivatives. It is not itself a hormone, but it has some structures quite similar to female hormone. So it has a little bit weak hormonal effect. So if somebody really don't like to take hormones, some contraindication. So some examples is soya, soybean products, soya sauce, soya milk, maybe sesame, peanuts. So this might help. Okay, but if general, so something rich in calcium, because protecting the bone is still important. So something rich in calcium, like milk, again soy milk, fish, especially those who will eat their bones, sardines. Okay, and you might just take some vitamin D supplement together with calcium supplement, because taking just calcium is difficult to absorb by the bones. But for the traditional Chinese soup, prefer not, because this is more effective in increasing your cholesterol level than increasing your calcium level.
Interesting. So I'm sure there's way more questions on that, but let's hold it off for the Q&A session. Thank you, Dr. for the insightful comments on menopause. So right now, actually, let's turn to Miss Anita Chan.
Good morning.
Good morning. And we know that for women's well-being, it is a very important topic. And what aspect of healthcare can better support women's well-being?
So to me, well-being is a very holistic thing. Like how do we keep ourselves healthy, both physically and mentally. And also, one very important part is the empowerment. So in the healthcare sector, not only we used to be really focused on treatment, right? But we should start doing more on prevention and education as well. So I believe like both university, academia, practicing clinicians, they are all doing the full spectrum from prevention, awareness, all the way to active treatment. So that is all the different part of the healthcare that we can do to make ourselves even better healthy and live a good quality life.
Yes, very important. And the holistic aspect of well-being, especially. Exactly. So speaking of holistic, just now we kind of tapped on the physical sides of it with menopause and fertility. I was wondering, and this is a topic of what I'm very passionate about too.
Yep.
What role does what role does mental well-being play in the overall women's health across all stages of life?
Oh my God, this is like, I believe it's the root, it's the core. Everything, I believe, begins from here. If you believe you can do it, you can do it. Like, if I believe I'm pretty, then I'm pretty, right? But seriously, ever since we were born, like, physiologically, we have all this growing spur, like from puberty, we experience PMS. after childbirth, baby blue, menopause, all these are all the different mental conditions which we actually, if we anticipate, accept it, and most importantly, have the support system. And that will help us to live our daily life much more easier.
Thank you. That's very important, and I know we tackled it a little bit before, but how does like women's mental health intersect with issues of what we touched on just earlier, like menopause and fertility preservation?
So again, it's what we talked about earlier, so it's disease education, not necessarily disease education, but to have the information available, the true, factual, not just searching from the website, get the real, genuine, with evidence-based information, and it's no big deal, it's part of life. Accept it, have the proper approach to deal with it. If it's something is behavioral, can deal with it, then we do it. If it's therapeutic or medicine's needed, then go with it. And most importantly, I believe it's a support group, either from your friends or family, is very, very important. Like Jessica, our female gathering group is a very good supportive group.
Yes, and on that, thank you for bringing us all together.
Yes.
On this topic, thank you, Jessica. Yes, it's very important to understand, you know, an evidence-based approach, taking an educated approach into dealing with these issues, and having the acceptance for it,
Exactly.
Embracing it,
Yes.
embrace aging and the beauty that comes with it. And I think as we touched on the floor, whether we see it as half full or half empty.
Exactly.
Yes. So can you name a few initiatives that you have found most successful in improving women's overall health outcomes?
I believe it's actually embracing who we are. Seriously, look into ourselves. It's believe, yes, we are human. We are finally one human. It's no different from men or women. We're still facing the same similar issues. It's just in the female, we have our puberty, we have our menstrual period, we have our menopause. But then accepting who we are, I think this is one of the most important attributes or initiatives. And again, I really truly believe in education, helping our younger generation, starting from even toddler, all the way to like my mom is 93. We still can let her know her life can be even better and more interesting, still playing mahjong. So I believe this believing in ourselves, embracing is very crucial, the initiative. And I would like to see the community, we all get together, have more supportive program for different age and different stage of life.
Yes, and thank you for that, because I think it's such a wisdom to be imparting on this group today, and such empowerment too, because all we need is to believe in themselves, and we all have it within ourselves.
Yes.
Can you also give us a bit of examples, particularly addressing the emotional and psychological aspects of women's well-being, and maybe some actionable steps?
I would say it's stay active, be proactive, really actionable. Like if you go do exercises, the good, happy hormone will come out, and you actually go out and enjoy the sun. Go to the beach or go have a few ice cream. Yes, I know, low fat. But once in a while, yes, Gillette. Once in a while, I mean, under controllable condition, we should be entitled to enjoy ourselves and give ourselves a touch of sweets. Yeah. So stay active and also proactive to find any treatment. Like you said, ventilation. Talk to your friends. One of the practice I use myself, you know, sometimes people don't want to hear you, yeah. So I write them down. I really do write them down like a self-reflection. I may take a look at it, read it a couple of years later, and then it's a self-reflection after all. So those are really two good tips I would suggest is stay active, action, and proactive, and even let yourself be vented. It's okay. It's okay to be yep, or maybe by yourself write it down, or you find a good support group.
So you love yourself.
Yes.
Yes.
Nothing more than loving yourself and embracing who you are. Yes, I may have a few wrinkles, and so what? I'm who I am.
That is a very important attitude. Thank you for shedding light on this. And can we give a round of applause for all of you? It's a very wonderful conversation. Super insightful, informative, yet very engaging. Now, how about we open up to the ground and see? I'm sure there are a lot of questions, but don't be shy. And if you have any
Question.
Thank you, David.
Thank you. David's the class manager. My boss is here. Award. And thank you, Jessica, for kindly inviting us along. I have a question. Absolutely inspiring to hear you, and I love your practical and happy way that you're presenting things. It's so uplifting just listening to each of you on stage, indeed compared to your inspirational yourselves. If you could be my doctors, that'd be fantastic. I'd be coming out to see it regularly. I had a question, it was kind of to all of you, but you did mention it there about, take an evidence-based approach. Where would you suggest people go for this? Because in the world of Facebook medical academy where people go, I'm hearing people all the time finding fake news out there and crazy remedies. They've now got a thing called ChatGPT, which can give you the best lies ever, and they're very convincing. Where should we go with your medical and expert opinion? Where should we go to get that trusted, guaranteed, verified advice that you can trust? Thank you.
any of you?
Maybe I can, this is only part of the outlet that you can go to. Of course, we go to our doctors. And also our primary care doctors. It is a gateway where you actually get your most accurate information. Specialists, like for the female health or men's health, we have neurologists out there. But the first gateway, you can actually go to your primary care physician and also our community pharmacy. It's free. You go to our pharmacy, go to talk to the pharmacist. They do have evidence-based information, at least very generally. But I would suggest don't over-research online. Oh, what is menopause? How am I going to deal with it? Well, how can I have a nice sweat? But go to the proper credential academia, to our doctors, our pharmacists. That would be the first step to get an evidence-based information.
That's a great question, by the way. So instead of going to Dr. Google, now you know where to go to.
Maybe I add a little bit on evidence-based. So I would say, sounds great, evidence-based. But with more knowledge, we will be changing. Not that we are telling lies, but because we know more, we understand. So sometimes, I always say, it's a tennis match. Do it, don't do it, do it, don't do it. So we are not telling lies. Maybe it's conflicting because it's with time, we gain more knowledge. But when you go to the internet, they will just put everything without the time scale. That's why you see, take it, don't take it. Okay, so go to a specialist because theoretically, we should have analyzed, we add on knowledge from time to time, and then we know the pitfall. Just simply make hormones. At the beginning, a few decades, when it first popped up, wow, keep me young. Okay, then 20 years ago, there's the million women studies. Oh no, it causes breast cancer, it causes kidney heart disease, it causes stroke. Everything bad. Okay, then in another 10 years ago, somebody reviewed the paper. Oh, no wonder they are prescribing to 60 plus women who have menopause for over 10 years. Of course she has stroke, of course she has ischemic heart disease, because before she started the hormone, she already had this. Okay, so it is adding on the information, keep on refining our knowledge. So just go to your trust doctor. Okay, so theoretically, if we are up to date to our knowledge,
Yes, we
we will be also updating you on it.
Thank you. Yes. It's okay.
So I just want to emphasize, even though the information is true, is correct, it may not be applicable to your situation. What we have emphasized is individual care, individualized care. For fertility preservation, we have different ovarian reserve, we have different family planning, we have different value. Some lady would like to have more safety margin, more guarantee in terms of the fertility issue. Some will just have some preserve is okay. So I think individualized care is very important.
Very important. And yes, we have a question.
Yes,
please.
thank you. This is Yvette Lam. First of all, thank you. Thanks to Jessica for bringing this, wonderful, distinguished panel together. All the information I wish I knew when I was a young girl. So my question is that it really starts with young girls. How can we bring all this together so that a young girl can, number one, plan ahead, and number two, as a young girl can be supported to the mom or to the grandmom as they actually walk through different stages of their lives? How can we try to approach this holistically, not just from a physiological perspective, but also, from a mental perspective?
Well, I guess I love to talk. Again, it's back to education. It may be in Asian culture or in American culture, it doesn't matter. It's comprehensive when we plan our education things, starting from kindergarten, elementary school, high school, then we need to have a sustainable continuation on health, hygiene, and also all the supportive program. As Dr. Wong was saying, it's like time is changing. The information will be transforming. So ongoing, reviewing our educational program will be the primary, I would say the number one thing to go. So I guess we have someone from the education department get on to that.
So I think still most important is public education. So in my times, secondary school, no sex education, untouchable. Even somebody wants to talk about menstruation, we need to apply to the school principal and then don't talk too much now. Okay, something like this, but time change. And actually, we cannot stop this anymore because we will be getting knowledge from the internet anyway. So rather than avoiding the topic, I think the most important is to educate. Keep our population the knowledge. To know probably is better than to hide. So it all depends on the government, the education department, how strong can we push on this? Okay, and actually we are now from Yuen-Kwan so girls high so more, we need more to successful. So now actually even this we are changing. Okay, so we need to help the youngsters to know.
Yes.
Otherwise by the time 30s you tell them Yuen-Kwan is not girls high so it's too late. Okay, so start from very young.
Yes.
My answer is to organize more events like today. Yeah, thank you, Jessica. Yeah, because I think today's event is fantastic because it gives us a whole picture, from young, menopause, physical and mental is very, a good education opportunity.
Yes, and if I may add on, and we're looking at a cultural shift and to reduce stigma on some topics. And a lot of times when we mobilize the social change, it really starts from the individual. So the you and me here, and to start looking at it in a different way, so we'll see a ripple effect down the road and for our next generations. So a very important topic right here. I know Lindsay has a question. And we have one more question.
Oh, right, okay,
Yes.
I'll be quick. I think it's quite interesting that we're sort of putting the emphasis on the government and we're putting the emphasis on education. But surely we as women should be educating our young women. So, I'm 63. I have reinvented myself several times. I try, through the work that I do, because I work a lot with young women, to encourage them and empower them by example. So I think it's all very well talking about how we should get somebody else to do it, but I think we are responsible for the young women in our future. So it wasn't a question.
That's very well put, Lindsay.
Thank you, Lindsay. Hi, it's me, Jessica. Actually, Calvin was so keen on getting us on schedule, he forgot my opening. So, but no, I feel like I just really want to help tie up today's talk. First of all, thank you very much to our distinguished speakers. Thank you, Yvette, for flying on purpose, changing her flight. She came back to Hong Kong early for this. As all of you know, Jessica is about empowering women, and as Lindsay was mentioning, it's about empowering young women. I mean, it's not just young women, but it's women of all ages. But I think we are all young at heart, and for me, my inspiration comes from our 3 daughters. My mom never talked about menopause. I just thought menopause was no more period. That was it. Mom never talked about it. Whereas with my children, first of all, she's not here yet, but she started her menstrual cycle. and my experience with her, about when she had her first day, with my experience with my mother was completely different. And I believe that, Lindsay, you're right. It's about each generation, as we acquire more knowledge, we empower ourselves to empower the next generation, and we grow together. And the more that we know, the more that we're able to think for ourselves. I was very serious about, like Vivian was saying, if I'd known at the age of 25 that I could have planned further ahead, I would have. Simply because my original plan was to get married before I turned 30 and have all 3 kids before I turned 30, and I didn't meet Kelvin until I was 31. So none of that happened. But I think there are a lot of things that we as women did not know. And with the knowledge that we have, we'll be able to do much more things with our time, contribute more to society and community. With planning, maybe there are multiple careers that we could pursue. A lot of people want to put motherhood on hold. A lot of people want to have motherhood and they can't. And there's just a lot of these things that, especially in our society, this Chinese community, predominantly, there are a lot of things we don't talk about. We don't talk about anything, right? Well, that's what Jessica's about, helping us talk about things that people don't want to talk about, so that women more enabled to lead the lives they want to lead. Sorry, if you give me that microphone, I don't stop, so I have to give it to somebody else now. But thank you so much. Thank you so much, everybody.
So we're right on time, and I'll hand it back to Kevin actually.
All right. Sorry about that. I was trying to make sure that we're on time too. I keep the schedule and look at we're overrunning. Thank you, Jessica. Thank you, everybody. If any one of you have any more questions, feel free. All the speakers will be here for lunch. Feel free to go find them. Feel free to just mingle around during lunchtime and chit chat, but not during the presentation of the award. Okay, we have to respect those on the stage. Okay, so for now we're going to have a little bit of networking time with more guests coming in. Feel free to keep chit chatting, take more pictures, and where are my hashtags? Oh, sorry. But just remember, every single picture you guys take, please add jessicamagazine.com or add Jessica herself.
Just
okay.
me, you can find
Yeah, she will put it back on our IG. So thank you, Doctor. Thank you, Yvette. Thank you, Anita. Please enjoy the working.